The opioid crisis is destroying families and ravaging communities across the country right now. Desperate for a cure, more and more people are crossing the border into Mexico to try an alternative treatment. Well, tonight, one man is sharing his story about the treatment he says saved his life. It may look like a seaside resort, but what goes on behind these doors is no vacation.
My experience was tough. It wasn't easy.
He asked that we refer to him only as Bob. This is Bob before that experience, a 100-pound addict who'd been abusing opioids since he was only 14. His addiction started with painkillers after skateboarding injuries, but quickly spiraled out of control.
When I did a $5 bag of heroin, it did the exact same thing as $120 worth of oxys, so it was kind of a no-brainer to make the switch.
He bounced in and out of rehabs, but always caved in to the withdrawals.
It's a really miserable experience, and a lot of times during it, you feel like you're going to die.
And he might have. He was living in and out of his car when his parents sent him for an alternative type treatment south of the border.
When the medicine itself kicked in, it was very different than, let's say, eating LSD or magical mushrooms.
That medicine is ibogaine, a drug harvested from the roots of a plant in Africa.
Pretty much it's a reset of the brain.
Jose Serta runs Baja Ibogaine Center in Mexico. Bob was not treated at this clinic. Ibogaine is given in capsule form in this hospital. Patients hallucinate for hours. They're under a doctor's care during the treatment. Once it's done, they continue their recovery at this beach house. The whole process usually takes about a week.
A lot of people don't know what ibogaine is. Ibogaine is it's a psychedelic. It's the strongest psychedelic there is.
And it's illegal in the United States. The DEA classifies it as a Schedule I drug, meaning there is no accepted medical use and there's a high potential for abuse. In Mexico, ibogaine is unregulated and risky. It can be fatal for patients with heart problems and other pre-existing conditions. Addiction specialist Nancy Knott does not recommend it.
It creates a psychosis, which can be so absolutely life-threatening and mentally threatening.
Dr. Tom Kingsley Brown runs an undergraduate program at UC San Diego. Off campus, he's become an expert on ibogaine. Brown says addicts often stop using after just one treatment, rather than the years it takes to be weaned off of methadone or another replacement drug.
Ibogaine is really helpful for taking away the withdrawal symptoms that you would ordinarily get when you stop using the opioids.
Bob says the physical craving stopped immediately, but he says ibogaine alone is not a cure.
You're never going to forget how good a high feels like. You're stuck with that curse for life. But what ibogaine does is it gives you the option of whether you have to react on that urge or not.
Clean now for 8 years, he believes it's a curse he has finally managed to control. Now, treatment usually starts at right around $5,000. The U.S. Institutes of Health estimates that 19 people died during or after taking ibogaine between the years of 1990 and 2008. But the exact number is unknown, so make sure you get the information you need before you go try it. Dave?